Welcome to The Explainer. Today, we're going to get to the bottom of a symptom that's, well, it's just plain confusing and uncomfortable. That burning sensation in your feet. Let's dive right in. Have you ever had that feeling like your feet are just on fire, but when you touch them, they're not hot at all? It's actually way more common than you think. So what is really going on down there? Okay, here's our game plan. First, we'll talk about what that burning actually feels like. Then, we'll dig into the causes, cover when it's time to call a doctor, look at ways to get some relief, and finish up with how to prevent it and the big takeaways. All right, first things first. What do we actually mean when we say burning feet? Because, the sensation isn't always as simple as it sounds. Yeah, the feeling can be all over the map. For some, it really is just hot or maybe prickly. But for others, it's more like a sharp stabbing pain. And get this, some people even describe it as a freezing kind of pain, which is so weird, right? You might also feel tingling or even what feels like a little electric shock. And a big clue for a lot of people, it often gets way worse at night. Okay, so now for the big question. Why is this happening? There are a bunch of possible reasons, but one of them is by far the most common culprit behind this kind of pain. And that main cause is something called peripheral neuropathy. Now, that sounds complicated, but it's really just a fancy way of saying there's damage to the nerves that are far away from your brain and spinal cord. The ones in your hands and feet. When those nerves get damaged, they kind of short circuit and start sending all the wrong signals to your brain, signals that feel like burning pain. So what causes this nerve damage in the first place? Well, the number one driver is diabetes. The link here is huge. I mean, more than half of all people with diabetes will at some point develop neuropathy. It happens because high blood sugar over time really does a number on those tiny delicate nerves. But it's not just diabetes. You can see here there are a bunch of other things that can cause the same kind of nerve damage. For example, heavy, long-term alcohol use is basically toxic to your nerves. Kidney disease is another one. If your kidneys aren't filtering properly, toxins can build up and damage nerves. And even something like a major vitamin B12 deficiency or certain infections can set off that same burning sensation. Now, it's also really important to know the difference between the kind of nerve damage we've been talking about and something else called a compressed nerve. See, neuropathy is usually a bigger systemic issue that affects both feet. But a compressed nerve, that's more of a local problem. Think of it like a pinched nerve in just one spot, like your ankle or in the ball of your foot. A perfect example of this is something called Morton's neuroma. It's when the tissue around a nerve near your toes gets all thick and irritated. This causes a burning pain, usually right in the ball of your foot, and it comes with this super specific feeling. A lot of people say it feels like they're walking on a marble. And just to cover all our bases, sometimes that burning feeling has nothing to do with nerves at all. It could be a skin thing like athlete's foot, or maybe an allergic reaction. It can even be a circulation problem. That's what happens with something called peripheral artery disease, or PAD, where your arteries get narrow and not enough blood can get down to your feet. Okay, I know that was a long list of potential causes. It can definitely feel a little overwhelming. So with all that in mind, what's the absolute most important thing you can do if this is happening to you? Here it is, the most important point of this whole explainer. Do not ignore it. If you've got a new, sudden, or really bad burning feeling in your feet, that is your body telling you to go see a doctor. Seriously, trying to guess what it is on your own is just too risky because the right treatment totally depends on what's actually causing it. So what happens when you go to the doctor? Well, they'll probably start with a physical exam and just talk through your medical history. After that, they might do some blood tests to check for things like diabetes or vitamin levels. And sometimes, if they need more info, they might order special nerve studies to get a really detailed look. All right, so let's say you got a diagnosis. What now? The good news is there are definitely ways to get relief. Let's talk about what those are. Okay, so the absolute top priority is to treat whatever is causing the problem in the first place, right? If it's diabetes, it's about getting blood sugar under control. If it's a vitamin deficiency, you fix that. If it's an infection, you treat the infection. Tackling the root cause is the only way to stop the damage from getting any worse, and sometimes it can even make the pain go away completely. And don't underestimate the power of lifestyle changes. I mean, these can make a huge difference. We're talking about things as simple as just wearing shoes that actually fit well and don't squeeze your feet. Physical therapy can be great for building up strength. And if the pain is chronic, even talk therapy can help you learn ways to cope with it. Now, to manage the pain itself, doctors have some special tools. They often prescribe medications that are designed specifically for nerve pain. So these are not your typical everyday painkillers. They're usually things like certain anti-seizure drugs or even some types of antidepressants, because those can help calm down those haywire nerves. There are also topical creams with things like lidocaine that can help numb the area. And this is super important to remember. Your standard over-the-counter stuff like ibuprofen, it's generally not going to work for this kind of pain. And the reason is simple. Nerve pain comes from the nerves themselves, not from inflammation, which is what those drugs are made to fight.
Okay, we're nearing the end. So what are the biggest takeaways here? How can you actually protect your feet and stop this from happening or from getting worse if you already have it?
Really, it all comes back to taking care of your overall health. The connection couldn't be clearer. If you have diabetes, managing your blood sugar is everything. Getting regular exercise, eating well, and staying away from things that are known to be bad for nerves, like smoking and too much alcohol, all of that makes a massive difference. And here is maybe the most critical piece of advice I can give you. Neuropathy doesn't just cause pain. It can also make your feet numb, and that's really dangerous. You might get a small cut or a blister and not even feel it, and that little injury could turn into a major infection. This is why, if you have neuropathy, checking your feet every single day is non-negotiable. When you really think about it, a burning feeling in your feet is more than just an annoyance. It's a powerful signal from your body. It's a message that something bigger, something deeper might be going on. So I'll leave you with this question to think about. What are your feet trying to tell you about the rest of your health?